I'm Mark Zitter, chair of the Zedema Project, a member of the club's board of governors. I'm pleased to bring you this program, which is the first in a series of virtual sessions we'll be hosting here at the club. Today is March 18th, 2020. We are living in an historic time. The coronavirus and the disease it causes, COVID-19, are spreading rapidly and have changed life as we know it, and this seems to occur on a daily basis. And today, I should mention, is September 18th, 2020, 6 months after Bay Area health officials announced the nation's first shelter-in-place order. We had 7,500 COVID cases in America and 100 deaths. We now have 6.6 million cases and, of course, about 190,000 deaths. How much this world has changed in 6 months. The story is a split screen. On the one hand, we have exceeded 17 million cases of COVID-19 in America and lost more than 300,000 American lives. COVID-19 is now the leading cause of death in America. And last week, CDC Director Robert Redfield warned that for the next 60 to 90 days, we'll see more deaths from COVID-19 every day than we suffered during the September 11th attacks or during the bombing of Pearl Harbor. The news about a vaccine for the coronavirus is fantastic. We've created not one, but multiple safe and effective vaccines in an effort that many call the greatest scientific achievement in human history. So we have these two powerful vectors colliding right now, a burgeoning disease and a growing armament of vaccines to slow and combat the disease.
As the pandemic changed the lives of everyone in the Bay Area and across the United States, no one story was more significant than the COVID-19 pandemic. As a public forum to discuss the leading issues of the day with experts in the field, the club has presented more than 100 programs on different aspects of the crisis since mid-March 2020. As the Bay Area and the country expand its vaccination efforts, finally, we see the beginning of the end of the public health crisis that will change our communities forever. Exactly 1 year after life changed for us all, we look back and we look ahead at the COVID-19 pandemic.
Greetings. I'm Dr. Robert Lee Kilpatrick, the chair of the Health and Medicine Member-Led Forum here at the Commonwealth Club of California. And today in our Healthy Society series, we're going to focus on the campaign to vaccinate America. Now, this is the second program in a series of programs commemorating the 1 year anniversary of the Bay Area's Shelter at Home initiative. And we are delighted to welcome back to the Commonwealth Club of California, Dr. Bishara Shukhair, MD, who came to us some time ago, originally from Kaiser Permanente, where he was head of community health. And he is now the vaccination coordinator at the White House. So without further ado, I'd like to welcome you, Bishara. It's so nice to see you again.
So great to see you, Robbie. I'm so excited to be back at the Commonwealth Club. It's been a few months since my last conversation at the Commonwealth Club. Really happy to be here with you.
Well, we're really happy to have the captain at the wheel here to give us some insights. And I put together some questions. I'm representing the audience today, and we want to know as much as you can possibly tell us about the campaign to vaccinate America. So my first question is, what is your job description? And what is your relationship to the Biden administration and the White House? I'm sorry.
No worry. Thank you. Thank you, Robbie. So just to reflect a little bit, the President Biden created a COVID response team at the White House. He appointed Jeff Zients to be the coordinator of the COVID response team. And on that team, there are 4 coordinators working on different aspects of the COVID response strategy. So there is an equity coordinator, Dr. Marcela Nunez-Smith. There is a supply chain coordinator, Tim Manning. There's a testing coordinator, Carol Johnson. And there's the vaccinations coordinator, and that's the role that I serve in. Just to reflect a little bit more on the strategy that the president launched to help respond to the pandemic, it is a whole of government strategy. It is a strategy that's based on science. It's a strategy that's based on data, based on evidence, and not a strategy that's based on politics. And that strategy includes multiple tenets. And one key component of the strategy, Robbie, is to mount an effective public vaccination campaign that would get shots into people in this country's arms so we can get past this pandemic. So my goal is to really making sure that we are executing on this strategy so we can get people in this country vaccinated and we can get past this pandemic.
So what have you achieved so far?
Well, I do have to say, I mean, over the last 7 or 8 weeks that we've been in office, we've been really focused on taking those components of the strategy and getting them executed. So when you think about how we've designed the strategy around vaccinations, it really boils down to 3 big buckets of work. It's about making sure there's more vaccines, making sure there are more vaccinators across the country, and making sure there are more places for people to get vaccinated. And we've identified strategies and tactics under each one of these big buckets of work to make sure that we are getting shots into people's arms. And many of the audience here today probably is familiar with the fact that on the supply front, we've made significant progress. And the president did announce last week that we're going to have enough vaccine to be able to vaccinate all adults in this country by the end of May. And starting May 1st, he's directing states, tribes, and territories to open up eligibility to every adult in this country. So lots of progress on the supply front. Happy to talk a little bit more about that throughout this conversation. Lots of progress on making sure that more vaccinators are available. And we've used the PrEP Act and we've created more amendments so that we can make more and more professionals eligible to vaccinate people in this country. And of course, on more places to get vaccinated, we worked with FEMA, with states, with local health departments on creating more community vaccination centers across the country. We're launching mobile clinics across the country to reach hardest hit communities. We're distributing vaccines through federally qualified health centers, through pharmacies. So lots and lots of strategies on that front, and happy to go through as many of those as you would like and maybe share some of where we are right now when it comes to vaccinations.
Well, I recently had my second vaccination, and I have to say that the organization and the execution was one of the most seamless and efficient things I think I've ever seen in my life. Was largely staffed by volunteers who were enthusiastic, friendly. They spoke different languages. It was quite amazing. So if you had a hand in that, thank you very much. I appreciate that. Looking ahead, do you see any obstacles that need to be overcome? For example, to convince people who are nervous about the vaccine that it's safe?
Yeah, well, that is an important issue. Well, let me actually start by sharing that what we know is there are more and more people who are really excited about the vaccine. From survey after survey, we're realizing that more and more people have either been vaccinated or ready to be vaccinated ASAP. And that number now is north of 55%. And we're seeing more and more people are ready to be in that category. There's about 22% of folks who are in the wait and see category. Those are people who are curious about the vaccine. They want to make sure that others are getting vaccinated first, and then they're ready to jump in. And there's about 7% who would be ready to get vaccinated if they're asked by their employers, or if they're required to do so. And there's about 15% who are not going to get vaccinated. And we see this data from the Kaiser Family Foundation survey that does this vaccination monitor and issues regular reporting. So, I'm going to start with the good news that more and more people are ready to get vaccinated. And honestly, more and more people are getting vaccinated every day. So lots of good progress there. It is important, though, that we continue to build on the vaccine confidence. And I think this is a job that all of us have to play a role in. This is not just a government role, a federal government role, or a state government role. This is all of us. And we know from focus groups, we know from surveys that people trust their doctors, people trust their nurses, people trust messengers in the communities that they work with, and they have full trust in. So we really need to all be on this effort to making sure that we're building vaccine confidence. At a federal level perspective, and part of the president's strategy includes launching a public education campaign to make sure that we're building that vaccine confidence. And we are right now spending a lot of time having conversations with multiple stakeholders across the country to identify concerns, to develop the right messages for the right audiences that we need to engage, finding the right platforms, working to ensure that we're igniting a campaign at the right moment when we have enough vaccine supply that would actually be able to meet the demand that we will be bringing from this public education campaign. So we're really excited about this work, but Robbie, we are under no illusions at the task at hand. And that's why our team has been meeting with community leaders on a daily basis to hear their thoughts, hear their ideas, their perspective. And we're meeting communities where they are. And we will be leaning on trusted messengers across the country with tested messages. So it's really important that we continue to double down on building confidence in the vaccine. And one thing to keep in mind, all three vaccines that are available are safe, they're highly effective, and we've administered already over 110 million doses in this country. And so we'd want folks who got the vaccines to be able to share that with others and help build the momentum and the excitement to get us to vaccinate the rest of the country.
So, from a science and a technology point of view, you mentioned there are three vaccines. I think the Pfizer, BioN, the Moderna, and the Johnson & Johnson, the Janssen one, sort of kind of like one size fits all in the sense that you get one of those. But you're an expert in community health. And so you mentioned talking to community leaders, for example. And we've all read in the news that there are some differences in terms of the percentage of certain populations that have tested positive or even died based on race or gender or age or what. So what's your strategy looking ahead, how to reach populations that, to use the modern language, I suppose, are historically underrepresented, if you see what I mean?
Well, thank you, Robbie, for bringing up this extremely important issue. And let me start by saying equity has been at the center of our national vaccination strategy from day one. And everything we do, every program we launch, every policy we put in place, equity is really front and center in this discussion. And I have to tell you, I get asked often, how do you balance between efficiency and speed of administering vaccines and equity and fairness? And the reality is we don't have to choose either or. We have to do both of those. Like we have to get as many vaccines into people's arms as fast as we can. At the same time, we have to do this in an equitable way. So I can just reflect a little bit on some of our equity programmatic efforts that we've put in place. On day one, the president directed FEMA to work with the CDC on supporting states, tribes, territories, and local government in standing up community vaccination centers. And we are now piloting many of those centers across the country. I think there are 18 of those sites that are up and running right now, including one in East Oakland, one in East LA, but also including others in Florida, in Texas, in New York, in Chicago, in North Carolina, in Michigan, and other places. And when we started working with states on where we place these community vaccination centers, we've looked at communities that have higher social vulnerability index to make sure that we're reaching communities that have been hardest hit by the pandemic to get them access to the vaccine. On top of that, we're working on a mobile program. So each one of these community vaccination centers, particularly the larger ones, are tied to hub and spoke type of approach, where you have literally vans or mobiles that are going into communities, setting up pop-up centers with community-based organization, with faith-based communities, to really make sure that the vaccine is available in some of those communities. Another program, Robbie, that I'm really proud of is our work with federally qualified health centers. And in just a moment to talk about community health centers, there are about 1,385 community health centers across the country. These are funded and supported by the federal government. They serve about 30 million people across the country, 60% of whom are living at or below the federal poverty level, 2/3 of whom are racial and ethnic minorities. And over the last few weeks, we've started onboarding these federally qualified health centers to be able to receive vaccine and administer vaccines to their patients. So in the last 3 weeks, we've onboarded 225 of these federally qualified health centers that serve over 12 million people. And now they're receiving vaccines. They're able to vaccinate their patients. And we've just expanded that pool. We've invited 700 more. And over the next 6 weeks, we'll be onboarding those additional 700 federally qualified health centers to be able to get the vaccine, administer the vaccine, and get the vaccine into the arms of their patients. So a lot of the programmatic efforts that I think is so critical in making sure that we continue to address equity head on.
That's pretty ambitious. That's impressive. So what does the supply chain of the actual vaccine look like at the moment? Are you getting as much as you want, or are you not quite there yet?
Well, let me give you a little bit of perspective on the supply. When we got into office, the president asked Jeff Zients and HHS to purchase 200 million more doses of Pfizer and Moderna. So it was 100 million doses more of Pfizer, 100 million doses more of Moderna, and that would have gotten us to 600 total million doses of Pfizer and Moderna by the end of July. Okay. And then in February, the FDA approved the Johnson & Johnson vaccine. The CDC approved it as well. And now we have 100 million more doses of a new vaccine, the J&J, that's equally as safe, highly effective, that's available. And that would be that we should expect those 100 million by the end of June. And then because of the partnership between J&J and Merck, two of the largest healthcare companies in the country and in the world, now we'll be able to have Merck help produce more of the J&J vaccine. So now we project to have enough vaccine for all adults in this country by the end of May. And last week, the president directed states, tribes, and territories to make sure that all adults become eligible for vaccines starting May 1st across the country. Now, that doesn't mean that all adults will get the vaccine starting May 1st, but we want to make sure that we expand eligibility so all adults will become eligible by May 1st. So it's going to take us some time to get to translate all these hundreds of millions of doses of vaccine into vaccinations, into shots into arms, but we'd want to do this as effectively and as fast and in an as equitable fashion as possible.
So that raises a question for me. I remember when I read that the president instructed states and territories to make it possible for adults to receive a vaccination as of May 1st. I thought to myself, what is the relationship between the federal government and the states? What does it mean when the president instructs the states? Do they have to do what the president requests?
So let me just start by saying this effort to vaccinate America, it's an all hands on deck. We all have a role to play. The federal government has a huge role. State government has a big role. Local government has a role. You and I have a role. Everyone in this country have a role to get us there. And I'm so proud of the partnership and the close collaboration between the federal government and the state government when it comes to this vaccination efforts. We meet, the Jeff Zients, our national coordinator, meets with the governors every week. I meet with state health officers every week. We engage on a regular basis to make sure that our strategies are aligned, to make sure that we're getting everyone vaccinated in this country. When it comes to the directive on making sure that everybody's eligible, all adults are eligible by May 1st. This is a specific directive that will be coming from HHS to states under the authority of that the federal government has. But let me just be really clear. This is all about the collaborative approach that we've been taking with states, with local government, with not-for-profit organization, with faith-based communities. And this is what's going to take us to get past this pandemic, Robbie.
So I think, thank you. One of the questions I think the audience will have is it too early to say how the national campaign to vaccinate America will return us to some form of a new normal? What do you think the next 6 months will look like, for example?
Well, let me just start by saying what's really important is that we continue by executing on our strategy to getting more and more people getting vaccinated, more vaccines, more vaccinators, and more places for people to get vaccinated. And that's what we're spending the overwhelming majority of our time on the COVID response team at the White House in partnership with CDC, with HHS, with DOD and state and local government and not-for-profit sector. That's really what's going to be really critical to getting more and more people vaccinated. And as we see more and more people getting vaccinated, the CDC has already issued some guidance on what vaccinated people can do. If you're fully vaccinated, you can visit other fully vaccinated people without having to wear masks or staying 6 feet apart. You could visit unvaccinated people if they are at low risk for severe disease. You could refrain from quarantining and testing if you do not have symptoms of COVID-19 after being exposed to someone with COVID-19. And those, I think, were the first step in the CDC guidance on what vaccinated people can do. And I do expect we're going to get more and more guidance from the CDC as more and more people get vaccinated. And I think we've all heard from the president, as all adults become eligible for vaccination by May 1st, the president set a goal of having a semblance of normalcy back by July 4th with small outdoor gatherings and cookouts for Independence Day. So I think we're making good progress there. We still have a way to go. I'm really proud of the number of people who are getting vaccinated already. I think I've mentioned this earlier. We have over 110 million doses of vaccines have been administered in this country. We have more than 25% of adults have had already at least one vaccine, one doses of the vaccine. When you look at 65 and older, where 80% of the deaths have happened, 8 weeks ago, it was 8% of 65 and older vaccinated. Today, it's 65% of 65 and older have had at least one vaccine. So we continue to make progress. We continue to have to make more progress. But I do see the light at the end of the tunnel, realizing really well that we still have a long way to go.
Well, that's a hopeful story so far. So you keep talking about adults. Is there, as part of your national strategy, is there a plan to start bringing younger people into the mix now?
Well, there are, as we all know, Pfizer is actually approved for 16 and older. So the 16 to 18 at this point, the EUA from Pfizer would allow the Pfizer vaccine to be eligible for the Pfizer vaccine. And now we know there are more studies that are happening right now for the younger population. So we're going to have to wait for the result of those trials, evaluate those trials. They'll go to the FDA. The FDA would do its thing. And then once we have decisions from the FDA and the CDC, we'll be ready to roll up our sleeve and figure out what to do when it comes to kids. But it is an important aspect of the work that we need to keep an eye on.
Well, Bashar, it's hard to believe, but our time is almost up. And so I'd like to ask you to make, any final comments, talk to the American people, or in fact, maybe an international audience watching this program. What are the most important messages that you want to get across today, to recap?
Well, just as we're reflecting on this conversation, I do want to take a moment. A year ago today, I was at the Kaiser Permanente getting ready to start an executive team meeting when we heard from the Bay Area health officers about the order for shelter in place. And just reflecting on a year ago, it was new terms that most of us have never been very familiar with: shelter in place, social distancing, masking, all the stuff that became part of our life over the last year. We've all had to go above and beyond to get us past this pandemic. I do want to take a moment to thank the leadership of people like Sarah Cody and Tomas Aragon and Erica Pan, who really led the country a year ago when they called for the shelter in place orders in the Bay Area. And really reflect on the hundreds of thousands of lives that we lost in this country and across the globe to this pandemic, and really be hopeful that as we get more and more people vaccinated, we can see a light at the end of the tunnel. So my parting message here is to make sure that we continue to get vaccinated when our turn is there. We have 3 safe, highly effective vaccines. So my message to everybody, please get vaccinated when it's your turn with the vaccine that's available to you. And let's all of us not forget that we have to continue to keep our guards up. We cannot stop masking. We cannot stop social distancing. We have to continue those mitigation measures so that we have more and more people vaccinated. We don't lose the race with the variants, and we get past this pandemic.
So for my final question, it sounds like what you're encouraging all of our viewers today to do is to be an ambassador for vaccination. Is that correct?
That would be so outstanding, and we all have a role to play. And I have to tell you, there's so much enthusiasm and excitement for the vaccine, and we'd want to continue to spread this enthusiasm and the excitement so that those who are vaccine curious or those who are not as confident in the vaccine get excited and get vaccinated. And that's our path to get out of this pandemic.
Well, 2 years ago, when I first met you, we were doing a program on MLK Day in San Francisco in January 2019. So we didn't even know the pandemic was coming. And at that time, I thought to myself, how does this man who has such a big job seem so relaxed? Now your job's even bigger, and you seem very relaxed and very friendly. How do you pull it off?
Oh, Robbie, thank you. That's so generous of you. I think, I have to reflect back on, having a very clear strategy that the president set for us and really be focused 100% on execution. And most importantly, keep our doors open to listen to ideas, get perspective from people across the country. So for all of the audience here today, please send us ideas, send us suggestions, send us feedback. If there are things we can do better, please let us know. We're here to do everything we can to get us past this pandemic. So thank you, Robbie, for hosting me. And a big thank you to the Commonwealth Club for hosting this series.
Well, as I wrap up, I want to say if there are any young people watching this program today, this is what a real leader looks like. It's amazing to me how clear you are in explaining complex issues, and you're a team player. And I think what the message I heard today was we all have to work together individually, friends, families, communities, states, country, to pull this off. And I'm confident that you and your team are going to do it with our cooperation. So
thank you, Robbie.
Thank you for coming. To close up here, this is an example of what we do at the Commonwealth Club of California. We bring you this type of programming, and we have been doing it for 118 years. We are the leading public affairs forum in the United States. And now that we've gone 100% digital, we're reaching much larger audiences. I encourage everyone watching this program to join, to become a member. It's one of the best things I've ever done for a relatively small monthly payment. Go to www.commonwealthclub.org to join. And also, just after this program, we have another pandemic program, and then another one tomorrow commemorating the 1-year shelter-in-place initiative in California. So without further ado, thank you very much, Dr. Bashara Shukhair. I hope you have a lovely day.
Thank you, everybody.
Bye for now.